and pathogens that threaten our food supply and food security. I applaud all our food heroes, our farmers, fisherfolk, and our food industry stakeholders who establish certified food safety standards in their production processes. Additionally, I encourage all farmers and fisherfolk to continue to work with our regulators, employ smart husbandry and personal hygiene practices, and follow the labeling instructions of the chemicals you use to ensure our food security. Finally, I challenge you to join this multi-sector One Health approach in the fight against antimicrobial resistance. We can no longer be unprepared in this fight against the rapid spread of pathogens that cause infectious diseases which affect our animals and people. As we observe World Antimicrobial Awareness Week, to increase awareness of the public health challenge posed by antimicrobial resistance, we invite you to join us by employing the practices and industry standards that ensure we all have safe food to eat. Thank you, and stay committed to the fight. We are all in this together.
Thank you so much. That was Honorable Audley Shaw, who is the Minister of Agriculture and Fisheries, Minister of Industry, Investment and Commerce in Jamaica. Thank you so much for joining live on YouTube. And we want to remind you that we are in the opening ceremony for the World Antimicrobial Awareness Week, which is celebrated worldwide, and this is nonetheless being celebrated in Jamaica too. So far, we have gone through greetings from PAHO and from FAO and from ICA, and we switched our program up a bit because we wanted to share with you a special item. We had a little glitch, a little setback, but we now have that ready for you, and we'll be able to now share with you that special item, the very special young lady, a rising star. Let's take a view, let's take a moment, take a step, let's sit back and see what is in store for us. Dr. Miguel, please share the special item with us. Thank you.
Hello, my name is Leia. Today I'll be reading a poem entitled Save Our Antimicrobials by Susan Miguel. Knock knock, who's there? Antimicrobials. Antimicrobials who? Antimicrobials we need to treat us when we are sick. I heard that antimicrobials are chemicals invented to reduce or kill dangerous pests and germs. You know, like antibiotics to fight bacteria, antivirals to fight viruses, antiparasitics to fight parasites, and antifungals to fight fungus.
Cut!
When you hear something weird, soon we'll have no more antimicrobials to use. The microbes are fighting back. They're resisting the chemicals. You want to know why? We are misusing and overusing antimicrobials. We can help save our antimicrobials by 1. Following the doctor's prescriptions and taking the medicines properly. 2. Follow the vet's advice to keep our animals healthy. 3. Farmers use chemicals properly. Follow the labels carefully. 4. Everyone do not share your medicines with others. 5. Keep clean. I love to wash my hands. Everyone shout it out. Spread the awareness with me. Use antimicrobials wisely. Stop the resistance. Knock knock. Who's there? Antimicrobials. Antimicrobials who? Save our antimicrobials.
And that's a wrap.
Wow, that was worth the wait. Leo deserved a special round of applause, and I can hear it from wherever you are that you are cheering for her. You're very happy to see a young champion, just spreading the word for us. And everyone, there was something for us to take away in that presentation just now. We should stop doing a lot of things. And I'm so guilty sometimes of sharing the medicine. That one was directed at me. Thank you, Leo. I will stop doing that. Ladies and gentlemen, the keynote address and declaration of the opening of this week falls to Dr. the Honorable Christopher Tufton, who is also my MP, and he is the Minister of Health and Wellness. Let's join now his video presentation to us. Thank you.
Master of Ceremonies, the Honorable Audley Shaw, MP, Minister of Agriculture and Fisheries, Mr. Ian Stein, PAHO WHO representative to Jamaica, distinguished guests, ladies and gentlemen, members of the media, good morning to all. I am pleased to join you as we celebrate World Antimicrobial Awareness Week, which encourages stakeholders, including policymakers, healthcare providers, and the general public, to recognize that everyone can be an antimicrobial resistance awareness champion. This year is being held under the theme Spread Awareness, Stop Resistance. Under this banner, the Ministry of Health and Wellness will strengthen AMR surveillance through the development of agreed epidemiological and microbiological methods, the adoption of common definitions to enhance the ability to share and compare resistance information, and to attain a better coordination of the surveillance networks. In the healthcare settings, infection control measures and antimicrobial stewardship programs administered by multidisciplinary teams of experts are critical and effective strategies to prevent emergence and transmission of antimicrobial resistance microorganisms and ensuring the efficacy of available antimicrobials. Antimicrobial stewardship needs to be extended also to family doctors in the community, where there is a great consumption of antibiotics. The actions needed to reduce antibiotic misuse and inappropriate antibiotic prescriptions should consider information campaigns for the consumers, information and training for healthcare professionals, improved diagnostic for treatment decisions, treatment guidelines, and prescription audits. In veterinary medicine, the urgent need to take action for monitoring the antimicrobial use in food animals and enforcing regulations governing use of antimicrobials in food-producing animals, strengthening surveillance and monitoring, and reducing the need for antimicrobials through better animal husbandry. The Ministry of Health and Wellness is encouraging all participants on this platform to spread awareness about what AMR is, share stories about its consequences, and demonstrate how the actions of individuals, families, professionals, and communities affect the spread of AMR. Antimicrobial resistance is a complex problem affecting human, animal, plant, and environmental health, and it occurs when bacteria, viruses, fungi, and parasites change over time and no longer respond to medicines. Especially alarming is the rapid global spread of multi-drug resistance pathogens that have rendered common infections either more difficult to treat or in some instances untreatable, with reluctant, devastating consequences to patients. The U.S. Center for Disease Control and Prevention, CDC, conservatively estimated that in the U.S., more than 2 million people every year are affected with antibiotic-resistant infections, with at least 23,000 dying as a result of this infection. In 2019, the WHO identified 32 antibiotics in clinical development that addressed the WHO list of priority pathogens, of which only 6 were classified as innovative. Furthermore, A lack of access to quality antimicrobial remains a major issue, as antibiotic shortages are affecting countries of all levels of development, and especially in healthcare systems. Indeed, the cost of AMR to national economies and their health system is significant, as it affects productivity of patients or their caretakers through prolonged hospital stays and the need for more expensive and intensive care. Without effective tools for the prevention and adequate treatment of drug-resistant infections and improve access to existing and new quality assured antimicrobials, the number of people for whom treatment is failing or who die of infections will only increase. Medical procedures such as surgeries, including cesarean section or hip replacement, cancer chemotherapy, and organ transplant will become more risky. Addressing AMR requires a holistic and multi-sector approach referred to as a One Health approach, which recognizes that humans, animals, plant, and environmental sources cannot be separated in combating AMR. Up to 60% of all human diseases have origin in animals, zoonotic origin, that is. Human health has been challenged with threats of Ebola, avian influenza, SARS, and now COVID-19. The COVID-19 pandemic and antimicrobial resistance are parallel and interacting health emergencies that provide the opportunity for mutual learning. As their measures and consequences are comparable, the COVID-19 pandemic helps to illustrate the potential long-term impact of AMR, which is less acute but not less crucial. They may also impact each other, as there is a push to use existing antimicrobials to treat critically ill COVID-19 patients in the absence of specific treatment. Ladies and gentlemen, on behalf of the Government of Jamaica, I thank the World Health Organization, OIE, and FAO for their support for this campaign and pledge our continued collaboration in the way forward. Let us all work together to strengthen the public health system to deliver and to ensure the optimal benefit and the best health outcomes for national development. Best wishes for a successful week. Thank you.
Tough time. Ladies and gentlemen, we take the opportunity to remind you of the activities planned for you for this week. Please remember to join us on November 18th for Agri-Food Industry Day. That will be coming to you from 9 a.m. to 1 p.m. On November 19th, we invite you to come back with us, where we speak about infection prevention and control against antibiotic resistance. And we start at 10 a.m. and we go up until 12. On November 22, we want to discuss antimicrobial prescribing practices and regulations. And again, we start at 10 and we go up until 12. The focus on November 23 will be antimicrobial stewardship. And we invite you to join us from 10 a.m. to 12 noon. And we close off things on November 24 with a forum, public-private partnership in the fight against antimicrobial resistance. And we start at 10 and we intend to go up until 12 noon. We want to thank you so much for joining the opening ceremony this morning. Mr. Steen reminded us of the activities in PAHO and told us that PAHO has had this activity as a major one on their calendar since 2015. We thank you so much for your greetings and for all the support that you've provided to Jamaica. We also had greetings from Dr. Maria, who gave us the charge that as farmers, as producers, as traders, whoever we are, we're called to action to preserve antimicrobial efficacy. Ms. Shauna Brandon, who was from AICA, represented Dr. Elizabeth Johnson, and we know that we have been getting tremendous support from ICA throughout the years, and this too is a focus on their calendar. How can we forget this morning the special item that we had from Leon, Lady Leon, Queen Leon. And she gave us the charge, ladies and gentlemen, that knock, knock, who is there? Antimicrobial, it is there. So what should we do? And she told us of a number of things that we should do, including stop sharing our medication. And did you know that Dr. Miguel was the writer? So we have a vet as well as a writer in Dr. Miguel. Thank you so much, ladies and gentlemen. We also remind you of our remarks from remarks from the Honorable Audley Shaw, who presented to us and reminded us, ladies and gentlemen, that this is a One Health approach. And again, we're called to action and reminded of the rules of the regulators under his watch in both the Ministry of Industry, Investment and Commerce and the Ministry of Agriculture and Fisheries about the safety and wholesomeness of food and the responsibilities that those under his watch must bear and must respond to. Our opening was done by Dr. Christopher Tufton, and we are all reminded, ladies and gentlemen, of what we're told in school. No man is an island. No man stands alone. Each man joy is joy to me, because no one sector can fight alone. This is a One Health approach. And by being here today, you have taken on the charge and taken on the responsibility that you will be a champion. Let's keep the conversation going. Let's talk about this in our workplace and in our homes. Ladies and gentlemen, thank you so much for joining us for the opening ceremony. I will now hand you over to Mr. Stephen Davidson, who will be leading the charge regarding the panel discussions with the experts. The topics he will share with you in a moment. I thank you, ladies and gentlemen, and hand you to Mr. Stephen Davidson.
Good morning, everyone. Thank you so much, Master of Ceremonies, and thank you all for joining us for this segment of the program. And I'm pleased to chair the panel discussion with our experts. And see here, this is me. All right, so I'm pleased to welcome the distinguished members of the panel. We have with us Miss Michelle Black. She's a pharmacist and business owner, and she has been a registered pharmacist for over 10 years. And she is the pharmacist and managing director for Neil's Pharmacy. And she has also served as a chief pharmacist at the National Heart Foundation of Jamaica. She enjoys being of service to others and continues to volunteer, the voluntary activities. She enjoys traveling with family, when she finds the time, farming and all things construction. So we're going to hear more from her. We also have with us Dr. Osbill Watson. He is the Chief Veterinary Officer for the Veterinary Services Division at the Ministry of Agriculture and Fisheries, and we are pleased to have him with us. We also have Dr. Alison Nicholson. She's a Senior Lecturer, Department of Microbiology at the University of the West Indies, Mona, and she is also a consultant medical microbiologist at the University Hospital of the West Indies. And I am pleased also to join by Dr. Miguel, who is an all-rounder, right? So she's on with us as well to share in our panel discussion. And I invite all my panelists just to turn on their cameras so persons can see them when they're making their contribution. And today we want to look at what is antimicrobial resistance and how does it affect us. And I want to begin by giving my panelists just 2 minutes, in terms of their opening statements, and just to tell us what exactly is World Antimicrobial Awareness Week. So I'm going to begin with Dr. Nicholson. Doc, are you there?
Yes, I'm sorry about that. Good morning to you and good morning to our viewers. Welcome to World Antimicrobial Awareness Day. Let's go back a little. From as far back as 2007, the countries in Europe celebrated what is known as a World excuse me. Celebrated World Antimicrobial Awareness Day. So it was just one day that they celebrated. And during this time, they would have banners across the street, pamphlets would be given out, the media houses were asked to heighten awareness to this problem. So that's as far back as from 2007. Now, fast forward, and somewhere between 2014-15, WHO, PAHO, OIE, FAO, you'll be hearing those names bandied around. They were able to basically piggyback on this or start their own thing, and they decided that antimicrobial awareness was too important a topic to just give it one day. So they started a 1 week program, and during this time we would have contributions from all the different sectors implicated in antimicrobial resistance. So we have human health, animal health, plants, basically environment. So all our stakeholders now come together to heighten the public awareness to this problem. It is, as has been mentioned, I'm sure that we could not have listened to the presentations that have gone before and not be struck by the seriousness of this situation. So it's our attempt here in Jamaica to join our global partners by spreading this news and heightening the awareness of everyone in the population to the problem, the challenges we face of antimicrobial resistance. There is a schedule of events, I should mention that, and you will hear that repeatedly. There is a schedule of events, but throughout this entire week, we will be having different events focused at getting the message out. I'm sure you will hear that again at some other point during this presentation. Thank you.
Thank you. Thank you so much. All right, so I'm gonna ask Ms. Black to just share your opening statements and what WAAW means from your perspective.
Good morning, everyone. I trust that everyone is having a wonderful morning. As mentioned before, my name is Michelle E. Black, and I am happy that I have the opportunity to share. Now, as it relates to antimicrobial awareness, we, as the previous speakers would have alluded to, antimicrobial awareness is a well-needed strategy or regime that is to be put in place to have persons more aware, more knowledgeable of the use of antimicrobials. Now, in my research, I came across the PAHO's and WHO's core elements of antimicrobial stewardship. Now, stewardship is the way in which we handle something with care. So if we have antimicrobial stewardship, then there are some elements or strategies that must be incorporated. And different speakers alluded to these, but just to point out, we have what is called a commitment. So each person has to have a commitment to caring for, handling the antimicrobials. And this includes, as said before, a team effort, multi-agency, One Health approach. Also, there is tracking. There's a need to track and there's a need to report. There isn't a lot of information available here in Jamaica, and so it is important for us to not only track the event, but also report any adverse effects, any occasion of antimicrobial resistance. Also, there's a need to educate, which is what this week is about, education. So I take great pleasure in being a part of the panel, and I look forward to sharing and also learning about the strategies being implemented elsewhere. We have other agencies, and I'm very interested to hear and to share as we go throughout this week. Thank you for having me.
All right, thank you so much. All right, Dr. Miguel, it's your turn for your opening.
Yes, pleasant good morning, everyone. Thanks for inviting me to be part of this panel. For us here, World Antimicrobial Awareness Week, it's very, very important for us as a part of the task force for antimicrobial working group, which is part of the National Codex Committee. We are globally looking at 2 documents right now, and hopefully they should be passed. One is on the code of practice for antimicrobial resistance along the foodborne pathogens or disease. And the other one now is the development of monitoring and surveillance program for AMR. And also working very close with all the agencies, how we can actually strengthen and put surveillance program in place, which is what Ika mentioned this morning that we are on. So this is important for us to actually be part of this week and tell persons more about how they can be a part of combating world antimicrobials. Thank you. Resistance.
All right, thank you so much. And then to the lone gentleman. I'm so glad to have a male on the panel as well. Doc?
Yes, thank you. And morning again, everyone. Well, I think the ladies have said it all. And I can only say from a standpoint of the veterinary services of the country that we fully support the efforts of the WHO, the OIE, FAO, all of our collaborating entities and agencies as we launch World Antibiotic Awareness Week. It is a time when we need to reflect and remind ourselves years ago when our great scientists developed remedies that could treat diseases which would have been affecting mankind from way back when. And as time went by, companies came on, manufactured several antimicrobials, including antibiotics, antiparasitics, etc., that actually played a role in safeguarding lives, in ensuring food security, and making the environment better for us. But unfortunately, because of the activities of mankind in terms of the abuse, misuse, or overuse of these good things that were developed to safeguard us, we find that we are now at a time where it's almost that we are in panic mode, because right now several physicians, veterinarians, and other clinicians are having challenges treating certain simple diseases because of antimicrobial resistance. And so it is opportune time for us to again revisit what we're doing, spread the words to everyone, remind ourselves in animal health, in human health, in environmental health, in plant health, that if we do not act now, then very soon we will not have any antimicrobials that will effectively save our lives should we come down with something that needs an antimicrobial for its treatment. And so therefore, again, I say that we fully support the efforts, and we will do everything in our powers to continue to spread the word as we go through this week. Thank you very much.
Thank you very much. And this is really a very serious matter that, of course, we have condensed some activities in a week, but it's a year-long continuous because our lives are at stake. I wanted Dr. Nicholson just to tell me, we hear antimicrobial resistance, we hear World Antimicrobial Awareness Week. Just tell us just remind us in some simple terms, what is antimicrobial resistance? What is meant by that? You have to unmute, Doc.
Sorry about that. Thank you. Okay, so we say that an organism, and by the way, when we talk about antimicrobial resistance, we are referring to the organism, not the person. Okay, so we say that resistance has developed when an antibiotic that formerly treated a particular infection caused by or a particular organism is no longer able to do that. So most of us will be familiar with the name amoxicillin, ampicillin, amoxicillin clavulanic acid, and I've just drawn that out of the hat. It could be tetracycline, no promotion going on here. I'm just saying that there are certain agents that we know as antibiotics. They are household names, we've used them for a long time. Now, should we use those same agents against infections that they formerly treated? What we're finding out is that some of these agents are no longer able to treat common infections because the organisms causing these common infections have learned the secrets of how these agents act and can now evade the action of these agents. So this is an extremely serious problem. And as we increase the use of powerful antibiotics, the organisms continue to learn their secrets. So we now have organisms that are resistant to almost all antibiotics. I shared on another program earlier or late last week that I once saw an organism in the lab that was resistant to 21 of 22 antibiotics that was tested against it. And I share that again because I think it's alarming, and I think we need to use information like this to cause persons to be interested. Sit up and listen. We're losing antibiotics, and if we do, we will have a major problem.
All right, thanks so much. And as you talk about organisms, we have what we call superbugs. And I don't know if Dr. Miguel could tell us what is meant by that. Why are some bugs called superbugs, and what do we need to do, to guard ourselves? Dr. Miguel?
Mr. Dilson, can I ask Dr. Nicholson to take that one?
Sure,
because
sure,
that
sure,
is really
Doc.
her expertise.
Yes.
And she has seen some things happening there that I think she'd like to talk about. So,
Sure, Doc Nicholson, it's on to you again.
All right, well, I kind of touched on them in my previous response. So the organism, for example, that I shared with you that was resistant to 21 of 22 antibiotics would be regarded as a superbug. So our superbugs are bugs or microbes, organisms, bacteria. We're talking about antibiotics, so we're specifically talking about bacteria here. So bacteria that have become resistant to a wide range of antibiotics formerly effective against them. Just to note that not all antibiotics are made to treat all agents. So we're talking about an agent, an antibiotic or antimicrobial agent, antibiotic to be specific here. An antibiotic is produced and you're told which organisms this antibiotic can be used against. So when that organism begins to get resistant to all the agents that have been designed specifically to treat it, this is called a superbug.
All right, and I know we heard our ministers refer to the one health approach, and I just wanted to find out what do we mean by the one health approach, and how can that help us to move forward. It's a very serious issue that we're having. Cannot depend on one entity or one person to do it. So we're saying it is a one health approach that we're taking. So from each of your perspective, you can just let me know, what do you think, what the one health approach looks like, what it really should look like. I don't know if Michelle wants to start.
Okay, not a problem. All right, so the one team or one health approach, as mentioned by some of our speakers, it is the idea that everybody has a responsibility or a role to play in antimicrobial stewardship. It includes physicians, pharmacists like myself, the minister mentioned the Bureau of Standards, patients, consumers or farmers, as mentioned before. It's not only the physicians writing the prescription, it's also the patients. The patients taking the prescribed medication. Once it has been dispensed, they take it as for as long as it should be taken. Now, I will point out to you, we have a lot of cases where, say, for example, a patient comes to the pharmacy and let's take the common augmentin, for example. The augmentin would have been written for, say, 7 days, and the patient may take it for 3 days. The patient feels all right, so the patient stops taking it. Now, the patient have the product there, and as I think Little Leah mentioned earlier, sometimes the patients have the antibiotic and somebody in the household or a friend or somebody at work starts to show similar symptoms to what they would have had. Now, many microbes would elicit similar symptomology. So not because you are showing the same symptoms or signs means it's the same microbe that would be causing the infection. So you go ahead and you share the rest of your antibiotic or augmentin with somebody else. That's not necessarily the best antibiotic for that person. So now, whatever organism would have caused your friends that organism can now develop some form of because remember, these are, for example, look how many strains or variants of COVID. So this will affect whatever is trying to fight against them, right? Not only that, we should not share our medications as patients, but also one of the things I want to point out is proper disposal of our microbes. Now, as the Honorable Alisha mentioned earlier, a lot of times these things get into our waterways. Now, we have the medication that we do not take fully and we throw it out in the garbage, or some of us, we're not very ethical when it comes to garbage disposal, so we just throw it outside. Now, these things get into our ecosystem. It gets into the fish that we eat. It gets into the animals that we consume. So, as I said before, it is the responsibility of the physician to write the correct drug, the correct dosage form of the drug, the correct frequency of the drug. When that prescriptions get to the pharmacy, the pharmacist holds the responsibility of dispensing the right drug, right? Not only that, but the pharmacist has to look into the prescription. Is the right thing for this particular patient? And the reason why I said that, just this past week, I had a patient, a young baby, who came to the pharmacy and the prescription had a particular antibiotic on it. No, it's not the most common antibiotic written. So I started to question the mother and ask her about certain symptoms that the child may or may not be displaying. Now, after that discussion, I realized there are some symptoms that should be showing to indicate a particular type of infection that the baby was not showing. So I said to the mother, I am not comfortable dispensing this medication because your child is not eliciting these symptoms. And she said to me, the doctor said she was not sure what kind of infection the baby was having. So another thing too is the physician's responsibility to ensure they dispense or they prescribe the right drug. And it goes back to the point where a culture and sensitivity test is many times required before we the best way or the most efficient way is to do our culture and sensitivity tests. When the baby went to the hospital, it was at a private practice that she got the original prescription. When she went to the public hospital, the CNS tests were done. And it so shows that the child was not suffering from an bacterial infection, but rather a viral infection. So that antibiotic that was given was not justified. So that's in essence misuse. So as I said before, it's a multifunctional approach. The physician, the pharmacist, the patient, the laboratories, it's a multifunctional approach to antimicrobial stewardship. Thank you.
All right, thanks so much. So Dr. Miguel, your perspective on what this One Health approach is in tackling AMR?
Yes, so It's very interesting that you highlight that, because in developing any surveillance program, any intervention, we realize that one sector, one group, one organization cannot solve it. Everyone is pointing to it. It either has to do with the veterinarians, the doctors, the pharmacists. You have to deal with the lab persons who are testing the samples that we're picking up and taking them to the lab, and to get the results back to find out that the organism is now resistant to more than one of the available antimicrobials out there. And then what do? We have to get back to the field for the intervention. But it doesn't stop there. Then we have to go back now and test to see if there is any residue or the pathogens are still around. What do we continue to do? And so has to be a joint effort. Everyone now has to be a part of it. It's not just the regulators. It's not just the in food industry, it's not the farmers alone, also the consumers, everyone. So the One Health approach that WHO, FAO, and OIE is taking is because they realize that every sector has a role to play. Information on one sector has to be shared with the next. What we're using in the animal world will definitely have an effect for the environment and for humans. So we can't just keep information to ourselves. We have to share it. And this is how the One Health approach is going to be done. There are antibiotics that are used in animals that we also use in humans, as you heard. That is one of the things that we want to make sure that has to be controlled. Regulations to how it is sold and used. And this is also the availability of drugs. We have to look at all of that. So when we're going through the entire week of these celebrations, you're going to hear how we are working together as partners with the international bodies, regional bodies, local bodies, all working together for one goal, our health. Whether the health of animals, plants, environment, humans, one health. Everything is connected. Thank you.
Thank you very much, Doc. And it's not only just the governments and the entities and the organizations, but as our average Jamaicans, there are activities and actions that we can take. And so I'm gonna come back to that discussion in terms of what actions the average Jamaican can take. But the veterinary services, Dr. Watson, you have a special surveillance program around food safety and primarily, for livestock. Can you talk to us about that surveillance program, what it's about, and what have we seen so far?
Okay, thank you. Well, first of all, I'm sure you didn't ask me my perspective in relation to the One Health approach.
You can give me that as well, you can.
Which perhaps would lay the foundation leading into the answer for your next question.
Sure,
because,
sure.
It is a fact that in excess of 70% of emerging infectious diseases are of animal origin. At 70% of emerging infectious diseases of humans are of animal origin. And that's important because human behavior in relation to how we treat the environment, how we rear our livestock, poor livestock management, if we eat unsafe food, inappropriate hygiene practices, we go into the wild and we encroach on our wildlife, and then of course we get Zika and chikungunya and rabies and monkeypox and all kinds of ills which actually we'd have known to be present in the wild. So therefore, as it relates to a One Health approach, the environment, the human-animal interface is critical in relation to stemming, in the first instance, infection of humans caused by these emerging pathogens, which would have come from animals, particularly animals in the wild. That within itself would prevent us from having to treat humans for infections, because we would have reduced the incidence of infection at the interface of the human animal environment type of bond. So as it relates to us furthering the activities in relation to safeguarding human health and trying to reduce the incidence of antimicrobial resistance, we must embark on what's known as surveillance, AMR surveillance. And so therefore, it is incumbent on us, the veterinary services, and also the Ministry of Health, to be aware of what organisms are out there as it relates to their resistance, so that we have to go and we do testing among the live animals, among the animal products, including your meat, your milk, your eggs, to determine what microbes are there. For example, salmonella, which is one of the common pathogens that we find out there. We will need to determine where do we find antimicrobial resistance among the salmonella grouping, so that we can inform ourselves, both in the human medical field and in the veterinary field, to say, okay, we are finding drug-resistant salmonella, we're finding other drug-resistant organisms, and so therefore we use that now to inform ourselves to put in place, for example, in animal health, vaccination programs, for example. So instead of utilizing antimicrobials at some levels, we do interventions in the field to vaccinate animals against certain infections, so that we cut out the use of antimicrobials to treat them should they get sick. So, for example, in pets and other animals, we have an active vaccination program for leptospirosis. And dogs, if persons who have pets will know, you take your pet to the vet and they vaccinate against a slew of infections. The distemper, parvovirus, parainfluenza virus, etc. In cattle, we would vaccinate against blackleg, clostridial infections. We would vaccinate against tetanus, for example, in horses especially, and donkeys, so that it prevents or reduce the incidence of these diseases in those species, so that the antibiotics are preserved, so that our critical diseases can be treated should we come across them. So the laboratory plays an important role in relation to our surveillance program, to bridge what's happening at the field level, so that our veterinarians and our medical doctors can know what's out there in terms of our microbes at the field level. What are they showing in terms of resistance, whether or not antibiotics, say tetracycline, will be able to treat, or they need to use penicillin to treat, or they need to use other. So therefore, I think someone earlier had said that pretty much one of the things that we need to do is not just to throw antibiotics at a patient. It is good to use the laboratory to conduct the necessary tests to see, yes, there's an infection, and what is the antibiotic of choice for this infection. So you do a culture sensitivity to determine which is the most effective antibiotic. So you don't go antibiotic hopping and you use one today and you change it 3 days time to say, oh, the patient hasn't improved, so I'm going to use something else. The pharmacist will tell you that, no, that's not the right approach. So it's a One Health approach for us to be able to make our lives easier, make our food producing animals much safer as it relates to providing the food, safe food to, from agriculture, safe food for humans, so that humans will not get ill from these potential foodborne illnesses that could be passed through food. So again, the veterinary profession plays a very important role at the level or the interface of the human-animal bond. Thank you.
All right, thank you so much. So you see, a lot of work is happening on the local level, and we're working with our international partners as well. Now, Dr. Nicholson could give us a little more insight in terms of what is being done internationally to stem AMR, and we can, if there are any best practices that we can adopt to the local industry. But if Dr. Nicholson, you could tell us in terms of what is happening internationally to stem this problem.
Yes, and that was alluded to by some of our speakers before, because they talked about the One Health collaboration. And that cannot be overemphasized, because to have persons from all the different disciplines coming together, human health, animal health, other aspects of agriculture, environment, that's really very important. Also, persons who look at the socioeconomic determinants of health. Having all of those persons come together to examine the problem and then make recommendations, and having representatives from all of these areas, that is a major win right there. Just to know that, look, you can't fight it in your own small corner. The vets have as a matter of fact, Dr. Watson, I must make a confession here. I had no idea that veterinary medicine, used antibiotics in the way that they did. So basically, you contribute as much to the problem of antibiotic resistance as we do. Initially, I thought the doctors were the ones who were the only players, and I was really surprised. I also want to throw another one to Dr. Watson. I heard that at an international meeting, I'm not sure how long ago it was, Dr. Watson, that this is international meeting where they were talking about the use of antimicrobial agents. My understanding is that Jamaica was the only country that took a stand against the use of antimicrobial agents in the local, was it poultry industry or was it animal industry? Totally, I'm not sure. But that makes me proud as a Jamaican, because at that time, the problem of antimicrobial resistance may not have been understood, and it may not have been as acute as it has now become. So it showed incredible foresight on behalf of our representatives to that international conference to say that in spite of all the other big countries supporting it, they stood their ground and they refused to support the use of antimicrobial agents for certain indications. Of course, use it when it's necessary, but for certain indications. So I want to commend Dr. Watson and his discipline for doing that. Now, you asked about other things that are being done. So I want to just mention the term antimicrobial stewardship. So this is a buzzword now. We have what is known as antimicrobial stewardship programs. And this involves bringing together all the components of a program that will restrict antibiotics. So for example, in a hospital setting, you have certain steps that are put in place to prevent antibiotics from being used arbitrarily. So there are some antibiotics that you want to protect their usage because you want to preserve them. And so they cannot be prescribed by any doctor. A doctor may be able to suggest the antibiotic, but it has to be countersigned by other doctors designated to do this. So this puts a tight supervisory rein on the use of antibiotics, and that's important. Antibiotic guidelines. So you go through the antibiograms, which would look at the antibiotic susceptibility profile of organisms commonly seen in your healthcare setting. And based on that picture, you will then set up guidelines saying if a patient comes in with X infection, start using this antibiotic and then move to the next and the next. Don't just reach for the top drawer antibiotic, because then you'll be exposing the top drawer antibiotic and inducing resistance at a higher level from the get-go. So antibiotic guidelines also form a part of antimicrobial stewardship programs. We could go on because there are many other things that we do, but I'll leave those because those are fairly broad, overarching, and under those come other measures that we take.
All right, Dr. Watson, you wanted to add something?
Yes, thank you. And I I thank Dr. Nicholson for raising that point, because I must commend the Veterinary Services Division, the Ministry of Agriculture, for the stance taken in relation to antimicrobial use in food producing animals, because we started quite a long while now to be bombarding our poultry companies. And I can say that I am confident that our poultry companies have adopted a system where very little, if no, antibiotics are used only where necessary. Other countries, they pump the antibiotics into the feed as growth promoters, etc. We here in Jamaica have stood up to our poultry companies and we say, no, let us not do that. Let us use antimicrobials only when necessary. And they have come on board for quite a while now. And we are happy to say that now you have a fight between the big companies to say which one is hormone free and which one is antibiotic free. So it's paying off. It's paying off, and we want to continue this process. Thank you.
Right, we actually do see that coming out in terms of their advertising campaign to see who is hormone free, who is pure, who is, wholesome, and that's where we want to get. So, of course, it's Jamaica, and we're a leader in everything. We find a way to come out on top at all times, right? But I want to ask Dr. Miguel if you could highlight some of the organizations, and I guess in a way of showing our thanks to them, some of the organizations that we are working with, on AMR, and some of the work that is being done there.
All right, before I start, can I give it to Ms. Black? I see her hand up.
Ms. Black, sure, yes. Michelle.
And then
Michelle,
I'll come back in. Sure.
Sure. Michelle, you wanted to add something to the discussion? You have to unmute. Did we lose her? I think we lost her. Looks like we lost her, Doc.
I think we lost her. All right, she
Right.
might soon come back in. Yes. So internationally, as I was saying, the three standard setting bodies, FAO, OIE, and WHO, and they have joined hands, and they have all came together in 2019 and said that they're pushing this global action plan for all countries to actually have national action plans to actually put in a One Health approach. And those who do have a national action plan to strengthen it. And it's very interesting that we have ECA in the region who is actually helping us to draft a surveillance program, the one that Dr. Watson spoke about, in terms of us going into the different areas to take samples to look for these resistant pathogens. It's absolutely important. But the reason why the world is making this known is because data is one of the biggest issues. Lack of data, lack of what is out there, lack of how we're going to make the interventions, lack of what is circulating in terms of antibiotics or antimicrobials. So we have to go out there to sensitize the industry sellers, the drug sellers, the pharmacists, the physicians, the veterinarians, the farmers, that we're coming out there, we're going to talk about the issues with them, but we're going to be taking samples and looking for a couple things. One, the resistant pathogens that we're hearing having an issue here. Two, we have to come and see what you're using out there. So antimicrobial use is one of those parts of your surveillance program. So you have antimicrobial use and then you have antimicrobial resistance. And we have to gather data for both. And this is what the world, international organizations are asking us to do so that we can actually make determined decisions, not just from agriculture point of view, but also health, also crops, and also the environment. I know they also talk about what is getting into the environment, washing off, where we use our pesticides to spray, what is actually going into the environment, how we can actually look for other alternatives. The world is looking now for all alternatives instead of just using all of these antimicrobials because of the effects it's having on us, on the animals, and even the pests. They are building resistance to some of these chemicals we're using, so to the pathogens. So it's now a wake-up call if we weren't waking up yet. It's now asking us, please, let us work together. So we're coming out there, we might put procedures and regulations in place. It's for a good reason. We have to find what is going on and gather the data and make the intervention. And this is where we are going, we're joining the world in doing that. That's why we're working hand in hand together.
All right, thanks so much. I think Michelle is back. Michelle, you wanted to make a point before we lost you?
All right, just to add, as Dr. Miguel mentioned, one of the approaches that could be taken is to report, track, not only the use, but also the resistance. And as she mentioned before, there's very limited data, right? And I just wanted to point out that all pharmaceuticals, whether it's used in the veterinary practice or in human consumption or whatever the case may be, these are registered and approved by the Ministry of Health. Now, during my tenure as drug inspector at the Ministry of Health, I know that there's what is called a pharmacovigilance watch. Now, this is an approach to garnering information or data on situations like this, like antimicrobial resistance, right? So there is the Pharmacovigilance Watch under the Standards and Regulations Division of the Ministry of Health, whose primary role is to oversee the importation, approval, distribution, use, even the disposal of pharmaceuticals. Now, through the Pharmacovigilance Watch, I know that there is partnership with drug companies. There's partnership with the Pesticides Control Authority, Ministry of Agriculture, and even NEPA and the National Solid Waste Management Agency. So these are some of the agencies that have a role to play in antimicrobial stewardship and tracking and reporting resistance. Right, and as I said before, big pharma or the big pharmaceutical companies, they have to play a vital role, a very vital role in this. And I would have wished that at least one of the companies would have been a part of this, because they do, as I said, they do manufacture and distribute antimicrobials that are used in different areas. Just to say that whilst you have a lot of medications being produced or developed year on end, there's a very limited number of antimicrobials being produced. And so it is essential for us to use what is available with due diligence, because not as much development of antibiotics or antivirals, antifungals are being done today. Right, so we want to emphasize proper use, and we want to emphasize the effects of misuse and abuse. right? And that is why, as I said before, this week's activities, they're very, very essential. And going forward, I would love to see other agencies will be brought on so we can take into action what we are discussing.
All right, thank you so much. That's a very important point. And I want to get to this big question now, is in terms of what can the average Jamaican do? So we want to, it sounds intimidating, but maybe there are some simple steps, simple actions that we can take as average Jamaicans. How can we help to solve this problem? How can we help to solve this issue? And I want to start with Dr. Watson from your perspective. There's some simple things. What can we do? What Jamaicans listening in or will hear us see this program, what can they do to help AMR?
Okay, thank you. So there are some very simple things in relation to what we all can do. Every single Jamaican has a role to play in all of this. One of the first thing, and maybe simple thing, is to know where your food is coming from. Know where your meat is coming from. Find out if the slaughter plant, if the butcher is licensed, if the meat shop is properly supervised by the public health department. Because what that will do is it will take effect in a backward way, whereby the farmer is forced to improve hygiene. The farmer is forced to implement good animal health practices, good agricultural practices, safe use of antimicrobials, use antimicrobials only when it is prescribed by a veterinarian. So it goes up the line where the consumer actually dictates the terms to say, okay, I need only safe food so that when I eat it, I won't have to rush to my doctor to say, I have a fever, I have a diarrhea because I consumed something yesterday, some meat yesterday, and it wasn't wholesome. So it's all a part of ensuring good hygiene practices at the farm level. We have instances where some farmers may find persons who are not veterinarians to assist in treatment of diseases. There are persons who call themselves vets and they prescribe. Now, the fact is that a veterinarian or a veterinary doctor is someone that has graduated from a university, from a college of veterinary medicine, with a doctor of veterinary medicine degree, which takes at least 5 years, to pursue. And that person now would have to do an examination with the veterinary board in Jamaica, pass that examination, and be registered or licensed to practice veterinary medicine in Jamaica. Those names are published in the register of the Jamaica Veterinary Board, which are available, I think, every year. They are published in the Gazette. Ensuring that you use the proper professionals is one of the other things. So therefore, make use of your animal health technician or your veterinarian. There are other things which you can do, which the average Jamaican can do to ensure that they protect themselves also. So like for pet owners, make sure that you take your pets to the vet. Your pet will be healthy. You can stay indoors with your pet and don't worry if you're going to get an infection from your pet and you're going to have to go get some antibiotics. And maybe the antibiotic that the doctor wants to prescribe can't work because there's some antimicrobial resistance because somebody down the road who is not a veterinarian was given that dog or cat antibiotics which would not have been appropriate at the time. So therefore you have the development of resistant bacteria. which then is passed on to the pet owner. So it's a part of the day-to-day activities that we are to ensure that we, just take these simple steps to safeguard ourselves, to safeguard the food chain, and to ensure that we enhance our own health and to maintain the proper level of hygiene right across the board, washing hands, and it's pretty much to safeguard ourselves so that you don't have the need to go and tell your doctor that you want a prescription for antibiotics, which it can be prevented. So pretty much that's it. There are other ways to do it, but that's where I stop right now.
All right. Thanks so much. Dr. Nicholson. Yeah, unmute.
Again, sorry.
Yeah.
I just wanted to say that I'm here representing the UWI and UHWI, and so I wanted to just share that we've done some research on the on antibiotic usage, and just to share here that more than 50% of patients, when they go to the doctor, they say that they accept antibiotics without having any explanation as to why they're being given and what it is supposed to do. More than 50% of persons that we interviewed, and this was done across the island, and more than 50% of persons thought that the same antibiotic could be used for all infections. Over 80% of persons felt that it was okay to share antibiotics. So you understand when you give somebody, as has been said, the course of antibiotics was designed specifically to treat the infection you're having where you're having it. And so when you stop short, you're actually leaving a few microbes there that have not been killed to then learn the secret of the antibiotic and become resistant. And then this resistant population can then be spread. So you do not share your antibiotics. You complete the course until science comes up with a different explanation. Right now, we're sticking with that. So you complete all the antibiotics that you will have been given, and you do not share your antibiotics because you really won't be helping other persons. So also I want to point out that the persons should be encouraged to wash their hands, take adequate precautions. If other persons are having a respiratory tract infection, then you keep your distance and you make sure that you watch what you touch and perform hand hygiene afterwards. That's very important. I want to mention that in the season of COVID, we have to brace ourselves because it has been found, and there's actually a publication out already on the impact of COVID on antibiotic resistance, to show that since the advent of COVID, there has been an increase in antibiotic resistance because, of course, COVID is causing respiratory tract infections. And that is one of the areas where we hemorrhage the use of antibiotics, because very often antibiotics are used for all respiratory tract infections, even when they might be viral. So we just want to alert our physicians to the fact that we don't want to take any chances. We don't want to put our patients at risk, but evaluate the patients appropriately to see whether they really need antibiotics or not.
Thank you so much. And I want to ask Michelle, in terms of when you're going to tell us in terms of what the average Jamaican can do as well, but you're representing pharmacists. And so what actions are pharmacists to take or to look out for? How can they help in this? And then, in terms of the average Jamaican, what can they do?
Okay, thank you. So firstly, from the pharmacist perspective, it is important for us to educate our patients on how to properly take the antimicrobials once we have dispensed them. One of the things that we tend to have an issue with, as I mentioned before, is persons taking their antimicrobials until finished. As Doc mentioned earlier, when they are not taken as directed or for the entire course, you leave microbes inside the body, and then these become smart. They find a way to resist the antibiotic. So it is very important that the average Jamaican understands the importance of taking the medication as directed, how it is directed and until finished. Another thing I want to mention, sometimes, say for example, somebody was in an accident or they got a cut or so forth, and they were given an oral antibiotic. Many instances I have found that patients, say for example, they got amoxil, which comes in a capsule form. So there's powder inside the capsule. On many occasions, these patients would actually open the capsule and dust the area, the injured site with the antibiotic. Now that antibiotic was given to take orally, right, for systemic effect. So if you do not take the medication as indicated, how you should take it for the length of time that you should take it, you're actually contributing to those microbes in your body developing resistance. And as Dr. mentioned before, when you have developed these resistant strains, you pass them around by poor hygienic practices. So it is very, very important that we practice good hygiene, good hand washing, cover your mouth, use the elbow to cover the bend of your hand to cover your mouth when you cough or sneeze. And as I mentioned earlier, it's a what you call a little issue I see arising. Many times patients go to the doctor, say they have a cough or they have some fever, and then the doctor surmises that it's not necessary to give antibiotic. There are many patients who feel that they have not been treated properly if they don't get antibiotics. So if you have a virus, the common cold, there's no need to get an antibiotic. For that, you just have to allow the virus to live its course, and that will be removed from the body. So when you go to the doctor and the doctor says, okay, I'm gonna give you some Brohex and some vitamin C, that's to help build your system, your immune system. So you do not feel as though the doctor doesn't know what he's doing because he didn't give me an antibiotic. It's not every disease that we present with requires the use of an antimicrobial agent, right? And I want the average Jamaican and other persons to just remember that. Not because you've not been given an antimicrobial means you're not getting the optimal therapy. And finally, as I said before, it is so important that we dispose of our expired medications and our unused medications properly. If you're not sure what to do with them, you can take them back to your pharmacy or the drug distributors, or you can contact the Ministry of Health. But it is very important, as I said, if it is not disposed of properly, it gets into our ecosystem. So those are just some of the little things I want the average Jamaican to remember, and not only remember, but to actually practice.
Right. Thank you so much. Yeah, and we know as our culture, when we feel better, we just put down the medication. We don't even bother, and we put it down until we feel sick again, and we say, "Oh, I had these pills. I got these pills the last time. let me use them." But whereas the biggest takeaway we're saying, do not do that. Finish the course on the medication, and allow yourself to heal. Dr. Miguel, you wanted to add to that as well? What can we do?
So, we're asking persons to change their behavior, right? And that is the greatest impact that all of us can do. And it's only and this is what the whole week is going to show. We wanted for persons to understand that the bad practices they are doing now, we are living and seeing the results of all that bad practice. That's the impact. And if we don't change now, our children, simple cuts and stuff, are you going to accident and you get abrasion, or you're working and you cut and you reach for that antimicrobial to treat it, or you have a pest out there, you need to reach for a chemical to spray it, or your animal is sick and you said, okay, I didn't finish it, but I'm going to use it. It expired, the drug expired. And you might say, well, last time a vet was here, they gave it 20 or 30 cc of this, and I have a little bit or whatever leave over. I'm going to just give the animal because it worked the first time. Those practices have got to change because we are seeing the evidence. The microbes are changing their cell and becoming resistant to what we're using out there. So we can't overuse them. We can't just throw them on there and expect that it worked the first time, it's going to work the second time. That is over. And we cannot underuse it either. As you were saying, you use it for a little bit and boom, you're all right, or the animal respond and you forget. And we have this thing as, we call it cover. We don't know what is there, so we cover everything, right? That has to change. We're trying to get the practices changed too, in terms of using the labs. I know it takes a little while for us to take the samples and take it to the lab, but you need to have choices of what is available to use so that you have the best result on the animal, the best result for the crops, and the best result for the environment, and the best result for us. Only when we work together to get the results, that is going to work. So what are all of us to do? Listen this week. Listen to what is happening in terms of antimicrobial resistance. We are told during this pandemic to wash your hands. This is very important. You want to stay healthy. You stay healthy, it gives your immune system a fighting chance. So when you're affected by any of these pathogens, it's fight. When you're sick, seek the medical help. That is what we're asking. Don't just run back to your old drugs or go back to something and use it. You're not doing best for yourself or for the animals or for the crops. We are the experts. We went to school, as Dr. Watson said. Use us. We are there to be used. And if we don't know it, we're going to go and talk to other experts. And we're going to get the medicine and the science to work with our people and work with the industry. Because we have to survive. We want to survive. We want to eat healthy food too. And so we have to actually ask everybody, start thinking about behavioral change. Behavioral change. Thank you.
All right, thank you so much. Thank you. And thank you to all my panelists. We want you to stay on a little bit because we want to take, if there are any questions from the attendees, I would ask them just to use the raised hand feature on Zoom here. If they want to ask any question of the panelists or to maybe just to chime in our discussion. So you have this opportunity now as we wrap to ask any questions. Just use if you're able to use the raised hand feature, or if you put it in the chat, the Q&A, you can post it there and I can ask on your behalf and get a response from our experts. So we're here looking at what is antimicrobial resistance and how does it affect us. And we're saying that we want to survive, we want to be alive. And so we have our work cut out for us. Any member of the audience here who has a question for our expert panelist, you should be able to use the raise hand feature on the Zoom here, or you can put it in the chat or in the Q&A, and we can ask. So we're going to wrap now. And so I'm just going to take closing thoughts, closing remarks, closing appeals from our panelists. I think Dr. Watson had to leave. I apologize for him. But we still have our other experts on. And if this is your last chance to ask any questions you may have as they wrap. So, Ms. Black, Michelle, you just want to wrap in 1 minute? What's your final thought?
Okay, sure. As I said before, antimicrobial stewardship in a bid to reduce antimicrobial resistance is a team effort. As mentioned over and over, a One Health approach. It takes into consideration our physicians or veterinarians, and or patients or farmers, or regulators, the Ministry of Health, NEPA, Bureau of Standards, the Ministry of Agriculture. So as I mentioned, team effort, and as alluded to before, we implore persons, not just the average Jamaican, but even us as experts, to remember that it is important. Take medications as indicated, as directed, for as long as to educate ourselves and our patients or consumers or farmers. And I should also mention, I don't know, I am not a part of the Ministry of Agriculture, but rather is a very important part in this because there's a RADA office in the parish. So we can educate RADA to educate our farmers, right? So my appeal to the Jamaican populace, it is everybody's responsibility. We all have a role to play, and let us
I think we possibly lost Michelle. You're hearing us. Possibly we have lost you. But we hear the passion. Dr. Nicholson, would you tell us your final thoughts?
Yes, thank you. I just want to reiterate that antibiotic resistance is a very real issue. It's not happening just in faraway places. It is right here. We have been monitoring antimicrobial resistance patterns, and it is safe to say that we are quite alarmed at the rate in which resistance is developing. So we want to appeal first to our colleagues in the human world and in the animal world to be careful how you use antibiotics. Be aware of the tremendous problem being posed. We would be catapulted back to the pre-antibiotic era, and that would be a shame. I think Alexander Fleming would turn over in his grave. And so I want to appeal to our colleagues, and then I want also to appeal to members of the public. Do not let this fall on deaf ear. It is estimated that by 2050, antimicrobial resistance will account for the death of 10 million persons per year, 10 million per year. This is not something to scoff at. This is something very serious. So I want to say to the members of the public, we need you. The members of the public need to work with the medical professionals, whether in animal or human health, in order to fight back against the microbes.
Thank you so much. I think we got back Michelle. Michelle, we didn't hear the ending part. Just want to give her the opportunity. Michelle, you're there? We're having some challenges there. Dr. Miguel, final word.
Yes, the passion is there. The passion is there. You know, it's all well and good that we are putting measures in place and we're putting surveillance and regulation and education out there to increase the awareness of this public health issue that is growing. But it also means that we now have an opportunity to actually stem the problem. All of us have an opportunity to just partner together and stem the problem. I don't want to reach a point, and science will show you that persons who go to the hospital or get some infection, or even in the animal world, we use first generation, that don't work, second generation, then you're going down the lines and you realize that you reach a point you have absolutely nothing left to use. It's hard to say goodbye. It's hard to lose our animals because of food security. It's hard that you can't go swim in certain river or lake because it's contaminated. And these are the things that we are seeing, and we want to bring attention to the public that please, we want to have everybody understand that every little action that you take today means guaranteeing our future. It means that we will have our antimicrobials around to use to just stem some of the infections that we're facing. So that, and don't overuse them and don't misuse them, and call on your doctors and medical professionals. That's what they're there for. Call for your public, your plant specialists, rather all those people out there who's working with you on in the crops, in the farms, all of them out there, they have all these expertise and science. And we're continuing, remember, science don't full stop, you know. Science has to change as things change. So we're gonna get more information, and so we want to share it. So that is why for every year, We might talk this year. Next year, we're going to have to say something else, because if it changes, we want to make sure you have the best information to make the right choice. So I'm encouraging everyone, every moment that you can actually join an event, read the newspaper, see the publications, whatever it is, or online, learn more about antimicrobial resistance and what you can do. Follow your doctor's instructions. Follow the label's instructions. Don't just throw things and expect miracles to happen. That doesn't work like that. We need to work together. And so as we leave today's event, I'm really glad that we are sending out the word. We've been doing this, Dr. Nicholson, for how long now? 6 years? And we're continuing. All right. So we're going to continue more, because we need to reach everybody, and we need for everybody to make the best choice to actually come on board and be an antimicrobial resistant champion. Spread the awareness, change your behavior, and so we can stop the resistance.
All right, thank you so much. So it is for all of it. We all have a role to play. We all can be champions, not just the government, not just international organizations, not just the research institutions, but every single Jamaican is important in terms of preserving life, and in order to survive, because we can be alive and then we're not surviving. So we need the full support of everybody. So this has been the launch of the World Antimicrobial Awareness Week. And before we go out, we have a video presentation that we're going to share now. And we have just ended the panel discussion segment. I want to thank Dr. Watson, Dr. Nicholson, Michelle E. Black, Dr. Miguel, who came in on as well on this discussion. And the recurring theme is this: the information is out there, experts are there, trust the experts, allow them to do what they do, use them up, right? Use them as resource persons, and we will survive. So of course, World Antimicrobial Awareness Week is going to be from November 18th to 24th. And we want to also thank our international partners, our partners in the region, PAHO, FAO, the Inter-American Institute for Cooperation and Agriculture, for their support in launching this week. So we're going to go to the video presentation now as we close off our launch of the Awareness Week.
Her baby died in hospital after catching a resistant bug. Her mother is recovering from an infected wound after her brother's birth. She's at risk of developing liver damage after contracting hepatitis at work. His family will go without because he can't work after surgery. 1 in 10 people pick up an infection while receiving healthcare. Yet they can often be prevented and should be prevented. We all deserve healthcare without avoidable infections. This comes from cleaning hands at the right times, preparing the skin before an operation, making sure needles and syringes are never reused, as well as dispensing antibiotics only when they're really needed. That's how they provide healthcare without avoidable infections. That's how their managers provide safer care with the right training, equipment, and programs. That's how to support healthcare without avoidable infections. People's lives depend on it.
All right, so again, underscoring the importance of antimicrobial resistance and the role that each of us have to play in, in stemming this problem. I don't know if this is Edwards Brown, you're still on?
Yes, I'm still here.
Right,
Who would want to?
I'm gonna hand back to you.
Oh, you can go ahead and wrap up, but I don't know who would want to leave this event. I learned so much and I've been chided and chastised, but I took my beating in stride. There are a number of things that I recognize that I've been doing wrong, and I will admit, and I will start making the change. I'm happy to have participated. I'm happy to have moderated a segment of this program. I've learned so much, and it is a One Health approach, and we're all in this thing together. I just want to take the opportunity to remind all of us of the events that are coming up this week. So on November 18, we have Agri-Food Industry Day, starts at 9 a.m. and goes up until 1. November 19, Infection Prevention and Control Infection Prevention and Control Against Antibiotic Resistance. That program will be coming up on November 19, starting at 10 a.m. and goes up to 12 noon. On November 22, Antimicrobial Prescribing Practices and Regulations, and that will start at 10 and go up to 12 noon. Then on November 23, Antimicrobial Stewardship, that will start at 10 a.m. and will go up until 12 noon, and things close off for the week with a forum with the public-private partnership in the fight against antimicrobial resistance. It was a pleasure being here, and I want to thank all the persons who participated in the event, in the platform. And, you know, Mr. Davidson, I've never heard anyone saying, use me, use me, use me. So the pharmacists, they have made an appeal. So I hope that we will take our part seriously in being champions in this antimicrobial resistance. And so I hand back to you, sir, for final close off.
All right, so thanks again, everyone. And of course, remember it's World Antimicrobial Awareness Week, November 18th to 24th. And our theme is spread awareness, stop resistance. And every Jamaican has a role to play in ensuring that we fulfill this theme and that we safeguard our lives and our livelihood. So enjoy the rest of the day. Have a great week. And we look forward to the full participation. Of course, these are webinars that you can register. And we want you to invite as many persons as possible to come on and to be a part of these sessions. Thank you so much. Enjoy the rest of the day. Walk good.